Good morning, everyone. My name is Kobe Okra, and I'm here with Mr. Matthias Jr. He is the Chief of Safety and Security at the Star Center in Tampa, Florida. And today's breakout session in room one would be discussing, contactless security screening measures for facilities operations during the COVID-19 pandemic and beyond. Without further ado, I'll let Mr. Matthias take the stage, introduce himself, and then kick off his presentation. Off to you, Dan.
Good morning. Good morning. I bring greetings to you from United States and the state of Florida. Before we get started this morning, I just would like to take a moment of pause to recognize all of the victims and families across the world that have been touched by COVID-19. Thank you. Just a brief bit about my background and CSSM. After 28 years of law enforcement experience, I made the transition into international and national security and safety training. I've done work all around the world and worked with security professionals from many countries. Who's certified with us today? So the CSSM certification, Contactless Security Screening Measures, was introduced to the world back in July as a direct result of the COVID-19 pandemic. And the training is currently available online and has been taken advantage of by several companies. As you can see here, there are a few companies that are located in Africa that have participated with our certification: Integrated Logistics Services, Control Risk, the Kenya Airport Authority, and also the Kenya Nut Company. So we've got a footprint already in Africa, and we are very excited about the prospect moving forward and making relationships and collaborations, hopefully. So why are we here? COVID-19 has made its mark and made its footprint around the world, and it's obviously had an impact not just only in one country, but the entire globe. And what has it caused us to do at this point? It's caused a shift, a total paradigm shift in the way that we think about security. And at this point, I must say that if you aren't doing some type of COVID mitigation in your facility, that could potentially be a risk factor. So where do we go from here? Where we go from here is we know that this is not the first and this is not the last pandemic. So as we move forward, we want to put a standardization of procedures in place that will help mitigate risk, limit liability, and more importantly, mitigate loss of life. So one of the solutions, the solution is training. Training. In law enforcement, as in your country and others, security professionals and law enforcement are some of the most highly trained professionals. And what we've done is taken what we consider to be the best practices and put it into one easy training solution. The course is available online, totally online, can be done in 45 minutes to an hour, and it's accessible anywhere, anytime from a smart device. We've put 8 modules together that we think best represent the best practices, security practices for COVID-19. First module is understanding risk mitigation in its totality, understanding that the risk associated with this particular infectious disease. This program can be put in place for any infectious disease, but we're dealing with COVID-19 right now. So those individuals that we want to target and take care of are those security officers, those guest management, guest services individuals that are on the front line, that are the first people to greet individuals that come into a facility. Social distancing. We've all heard of social distancing, and we want to put that practice in place, but we want to make sure it's standardized. Everyone's doing it the same way and understands it the same way. Personal protective equipment, masks are so important. Face coverings are so important, and we want to make sure that we're using it in the proper manner. This is a big one. This is one of my favorite to talk about, and that's nonverbal communication while wearing a face covering. How many of you have attempted to communicate or listen to communication with someone that had a face covering on? It can be a little tricky, right? So what we do is teach individuals to communicate by using hand signals, gestures, in addition to recognizing those hand signals and gestures. So for example, if someone is under stress or upset, they may raise their eyebrows or use their hands. Whereas we can't see a smile with a face covering on. We can't see a frown with a face covering on. We may not be able to recognize signs of danger or threat. So learning to read body language and learn a different method of communication while keeping yourself safe. Touchless thermometer techniques. I'm pretty sure at this point, some of your facilities, if not all, are using some type of temperature screening, measuring of body temperature. This was one of the solutions put in place when COVID-19, measuring a person's body temperature as an indicator that they may have some type of infection going on or something related to COVID-19. Many techniques out there to do that, but you want to do it right and you want to do it safe. This next module 6, this is totally new to the industry and the first of its kind introduced around the world. And that's the 9-3 handheld body scanning technique. Now, if you remember, if you've been searched or scanned at the airport or a government facility, that individual comes directly into your personal space in your face, and he or she moves the wand across your body. Well, that particular technique is not safe anymore because we know that we disperse aerial droplets as a part of spreading of the disease. So what 9-3 does is teaches those individuals to stand in a safe position on the side. 9-3 means the 9-3 position on a clock. So you removing that individual from that danger zone, if you will, or invading a person's personal space. Module 7 touches on touchless bag searches. We don't want to touch. One of the things that we know is transmission of not just COVID, but many other diseases through touching. One of the things that research has shown is that cell phones are one of the most infected, highly touched things that we have to process as security screeners. So we want to get out of the business of having to touch personal property. And so we teach a touchless bag search using traditional metal detectors and how to do that. And the last module is diversity, equity, and inclusion for security officers. And what this means is teaching security officers that to have a bit of empathy and understanding and how this pandemic has affected different people from different parts of life, all races, creeds, and colors, to have an understanding that everyone is being affected. So what are the benefits of your company or organization for training? Well, a good training program will help retain employees by investing in them. We want to have this program basically become the standard across all countries. Here in the U.S. and other places, there are certain certifications that security officers must have by law. I compare this contactless security screening measures to that of CPR or security officer training certificate. We want to make CSSM the training standard continent-wide. Certifying your team shows a health and safety concern for your staff and visitors. If you think about it, every facility and every public venue should have safety protocols for COVID-19 in place by this time. And to be able to use that to broadcast to your visitors and guests shows that your facility, your company takes their health and safety seriously. Keep your facility free from COVID-19 exposure to other infectious diseases. Security is usually the first point of contact when you come into a facility, depending on the type of facility, but security officers are right there on the front lines. And so the mitigation for your building, for your facility, starts with them. CSSM is created this training program for you with the invention of modern technology, such as this conference coming to you virtually as we speak. There's no need to create a new training program for your organization. CSSM has put this turnkey solution in place, and we are or could represent your in-house training solution. It's very affordable, as I said, and the training is based online. The certification could mitigate or offset cost and also help in the form of legal liability. When you have a trained professional performing something that they've been trained to do versus someone performing a service that they have not been trained to do, it leaves room for liability. And we want to close that gap by certifying everyone. The training is available in multiple languages. And more importantly, one of the things that I'm pretty sure everyone has had an opportunity to see on the news and around the world, especially here in the United States, that wearing a mask has become a controversial topic when it shouldn't be. The bottom line is to care for your fellow brother or sister. And we do that by protecting them as well as yourselves by wearing a mask, by seeking further education, and putting ourselves in the best position so we can keep everyone safe. And the good thing about this program, as the trends change, as updated information comes out from your CDC, we update this information and we stay relevant. So what's the next step? We know that there's not a question of if there's a need. There's a question is, how is it delivered and how do you implement? Okay. Public and private security companies standardize training mandates. As a private organization, you can and should require any private security organization that you employ or contract with to be trained across the board. It's no different from having a CPR certification, law enforcement or police certification for a police officer. This training is that important. At any type of venue, whether it's a stadium, an airport, a courthouse, a government building, a publicly run public service, it all applies to what we're doing here. The ultimate end product for CSSM is this to become a government mandated solution for every security officer, a standardized training. Think about nursing. Think about the healthcare individuals, from your EMTs, your nurses' assistants, all have to have required training. And we want to make CSSM that level of training. One of the biggest advantages with this certification is that this is a public relations campaign that is awesome. To be able to tell your public, your constituents, your visitors and guests of this new COVID-19 health and security initiative. This initiative is great for public relations. It lets the public know that you have a solution in place and something that everybody can see and understand. So the final outcome, I encourage you all to attend the workshop, and we're going to go through each module and deeper into detail to talk about each module and how it can be applied to your security personnel, to your facility management team, and anyone that is coming in contact with the people that are entering and exiting your building. One of the most important, I totally believe in training. This past year, I was put in a situation. I ended up saving the life of one of my coworkers who had suffered a heart attack. And I performed CPR and used a medical AED device, would literally save his life within seconds. And I was thankful to be in that position and have the training to apply in that split second that I had to make that decision. And that just came, that in itself, if I had not had the training and took the training seriously and took the training on an annual basis, I wouldn't have been there for my colleague to save his life. And that is my drive and my passion for training in this security industry. There's one type of security officer. There's trained and there's untrained. And one thing that COVID-19 has taught us is that we cannot outthink, we cannot predict, but we can react to what this pandemic has taught us and how we relate to it. So I invite everyone to please join the workshop and let us take you through the steps so that you get a very good overview of contactless security screening measures. And you might ask yourself, is this type of training already available? We've taken, again, what we thought and what we feel are the best practices from your CDC, from the World Health Organization, and other organizations that process this information. And if you're not using CSSM for this training, please get some level of training for risk mitigation and to limit your liability. This sends a message to all of your staff, all of your visitors and guests that your facility is taking the health and safety concerns of the visitors at a very serious level. And we're here to offer a turnkey solution. We have created a special link that you see here and a special code. If you have any additional questions, the email is listed below. And we'd ask that you send us an email with any questions. Thank you for your time and your attention, and safe travels, and please be safe. Thank you.